Hi everyone. Well, what we have here today is a patient that I operated on earlier this morning. She came to me about a month ago, and her main complaint was that she had a very weak chin, which is quite obvious, and this bothered her quite a bit. And she wanted to know what could be done without having to go through, big time oral surgery to, manipulate her jaws. And so we talked about various options, like, doing fat grafting or putting a chin implant in place. And I felt that a chin implant was going to be the best option to give her sort of the sturdiest and the most defined augmentation to her chin. Now, the only problem with just doing a chin augmentation is that part of her problem is the whole loss of definition of her jawline and this extra fatty tissue that she has here in the neck. And so this is a great operation because all through a small incision placed just underneath the chin, I can make a pocket for the chin implant and then use that same incision and perform liposuction underneath her neck. So let's erase this line right here, but you can see just by, if we can bring this out, and then, essentially get rid of, some of the fat, that's in here, and then we're bringing this out in this direction, she'll have a nice chin. I can show you an example of some digital imaging that I did for this patient, just to give her an idea of what it might look like afterwards. And on the operating room table, it was pretty close. Hopefully, in a couple weeks, we'll come back and I'll show you some actual before and afters of this same patient if she allows us to do that. So let's go away from here for a second. Oops. So the digital imaging can look something like this. We did three-dimensional imaging, and I converted this to a 2D image that I could show her, and she could actually look at this at the convenience of sitting down at her own computer at home. But it demonstrates pretty nicely how we can scallop the undersurface of the neck by taking out some of that. I mean, this is going to be a little sharper than what it will be in actual in real life. But this gives her an idea, and boy, what a change to her whole facial balance when when you bring out the chin and remove some of this fat underneath the neck. I think she's going to have a great result. It looked beautiful on the operating room table, and like I said, hopefully we'll come back to her in a few weeks when I can show you some actual before and afters.